Hello, and welcome to Jason Cavness Experience. I'm your host, Jason Cavness. I'm a retired U.S. Army officer and CEO founder of Cavness HR. At Cavness HR, we provide HR to companies with 49 or fewer people by providing an AI-powered tech platform with an actual HR business partner. We're also at Cavness HR hosting Cavness HR Seattle's Got Tech on July 30th as part of Seattle Tech Week. We have 16 tech startups doing demos of what they've built. Think of it as a tech trade show, followed by a talk on the future of HR and AI by myself, and the keynote by Kevin Goldsmith, former VP of Engineering at Spotify, like the current Spotify platform. He helped build that out, and he's currently the CTO of DistroKid. He's also going to be selling and signing his book, It Depends, writing on technology leadership. Cavness HR Seattle Got Tech and the Jason Cavness Experience is sponsored by Century Computing. Want to make sure your tech is always secure and running at its best? Century Computing specializes in managed IT, advanced cybersecurity, and cloud solutions, all built to help your business save money and scale with confidence. And the best part, they monitor it 24/7 so you can stay focused on growing your company while their experts handle the rest. Speaking of our tech demos, one of the company's demo, their CEO is actually the guest today, Dr. Ryan James. Ryan, thanks for being here today.
Oh man, thanks for having me.
So let's start with some good news first. Actually, great news, right? You did a post on LinkedIn, I think, just earlier today where you actually raised more money, right?
Yep.
I mean, congrats on that, right?
Thank you.
So talk about that process, right? Like, how did that come about? Because like this, most people in this space know about all these like VCs. I've never heard this VC firm. I guess because it's like more health tech based or something like that.
Yeah, it's an impact fund out of Yale. So Yale Main Impact Investment Fund. It's a sort of a student-related organization that invests in impact-focused companies, impact-related companies. And as you know, we're on track to help a lot of people access care. So that really resonated with them. And so it was just a natural partnership.
So like one thing I've learned doing this stuff, like there's actually like maybe not hundreds of thousands of VCs. There's a lot of freaking VCs, right?
There's a lot.
Like, how did you find this VC fund?
They actually found us. They saw me pitch on the pitch show, which has been tremendous for getting the word out on what we're doing. And so they were one of the folks who reached out and wanted to chat with us.
And like they always talk about, the VC firm doing due diligence on founders, right? But it's more important, I think, for us to do diligence on the VCs.
Word.
Can you talk about how you did that with these people?
Yeah, just looked up their backgrounds, particularly the due diligence team, but also the folks who lead that fund, the IC committee, like Nancy up front, who is a pioneer in impact investing. And so just having folks like that on our cap table that believe in what we're doing and that have a network of other folks who can help us is extraordinary.
So how did this process work? You did the pitch show, so I want to talk about that later. And what's the name of the firm out of Yale?
The Main Impact Investment Fund.
And so like when they reached out to you, were you like, okay, what's this? Who's these people? Like, I get emails all the time. We want to invest in you, but first give us like $20,000, some bullshit, right?
Yeah. A lot of folks who reach out, you never know. You never know what their angle is, what they're trying to sell you, etc. And so for us, I usually take a first meeting if it seems okay, and then I get a sense of who I'm sitting across the table from or sitting across the Zoom from, and take it from there.
And now, how do you of course, don't tell the details. I mean, if you want to, you can, but no, don't. Of course, you don't want to. But how do you do like the negotiation, right? Like they offer you, I'll make this up like $1.5 million for 25%. And you're like, no, that's bullshit. We'll take 1.5 for 10%. Talk about those negotiations, so to speak.
I mean, it's basically like that.
Yeah.
You also factor in like who they are, what value they bring, and why they want to invest, and if you want them on your cap table. And so we've also turned people away, but for us, this is a no-brainer.
On paper, it seems like a no-brainer. Yeah.
Yeah.
And this is your second investment?
I mean, we've raised a pre-seed round, so they were part of our pre-seed round.
Okay.
And that was about 1.6 billion after everything's said and done, and so they're rolled into that.
Okay.
But through that, we have a bunch of angel investors and VCs who contributed to that round.
So talk about this. I think it's a question a lot of founders have trouble with, right? Especially me, right? Like the investor would say, how much money are you looking for, right? And like I think some people are like, well, I want to be realistic, and like not be like ask for everything. So I'll keep it kind of like realistic. Like I'll only ask for 500,000. But in real, like man, if I want to go all out and really scale, I need like $3.5 million, right?
Yeah.
So how do you like kind of figure out what to ask for between those two things?
Yeah. The short answer is understand the market and know who you're talking to and ask for an amount that works, that fits into that. And I would say I learned that lesson the hard way. Talking to people who either weren't investing or didn't have the capital that I needed. Basically just talking to the wrong people. And so really I think an important part of the fundraising process is getting out there, talking to people when you don't need money to understand their check size and what round sizes they invest in, what their thesis is, and that sort of thing. And then when you're ready to raise capital, putting together a round consisting of people who fit into that round, and then going out and pulling the trigger.
And how many rounds did it take you to figure this out on your own, right? I'm sure you made some mistakes.
Oh man, I don't have enough fingers.
Yeah. And so how do you tell when you're talking to investors who are actually interested? Because a lot of time investors, like they're like kind of kicking the tires, doing market research, not telling you, or maybe they have a company just like you looking at, So how can you tell? Of course you don't have a crystal ball, but are you able to tell kind of quickly, okay, this guy or girl's just kind of like kicking the tires with me?
Yeah, I usually in terms of the follow-up, like when they follow up, how quickly they follow up, what kind of questions they're asking, and that sort of thing.
Is there an investing VC firm out that's like your dream VC? Like, man, if I could just raise money from them, I'd be golden.
Honestly, for me, it's about partnership. Like we've received investment from funds that you might not have heard of that have helped us tremendously. Like they have just gone out of their way to open up their not only their wallets but their networks and introduce us to people. And so for me, it's not about necessarily big brands, big names, even though of course we want those on our cap table as well. But I just want to give a shout out to the investors who really go to bat for their founders, because that's made a huge difference for us.
And how much time do you think you spend on fundraising? They say it's a full-time job, right? Yeah. But you still got to do everything else, right? Like, how did you figure that out, right?
Yeah, unfortunately.
You went from sleeping 8 hours a day to 2 hours a day or something?
Basically. Unfortunately, it's a full-time job.
Yeah.
And you gotta run the business as well. And so, like, managing employees, building product, developing strategy, etc. Like, you can't just put those things aside, but like when it's time to get money, you gotta focus on that, because nothing else matters if you don't have the capital to actually.
So how do you do this? Like, it's like people say, the main thing is the main thing, but if the background sales is the main thing, their marketing the main thing. Everything, little thing, their niches is the main thing, right? So of course everything can't be the main thing all the time. So how do you like every day decide what's the main thing for that day?
Team. Like we have a fantastic team at Dopl. I couldn't dream of working with better people than I work with right now, and just leaning on your team to handle the stuff that needs to get done, and then they can also lean on me to handle the stuff I need to get done. And so it's really a team sport. So
slight exaggeration, but on your website you have like thousands of advisors, thousands of consultants, right? like how do you make sure they're actually adding value and just not like a nameplate on your website, right? Because I'm pretty sure investors ask you like, or do all these people that actually invest money into you, or they provide advice? Like, how do you prove to investor anyone else like this is like some random name on there?
Yeah, we selected our advisors and the people we work with very, very carefully, and so for us it's about getting to know people over time before we decide to work with them, and then only working with the people who are really invested in one way or another. And so to answer your question, like if an investor asks me, is this person really really helping. I mean, one of the ways to demonstrate that is just to have that investor talk with our advisor, because our advisors are incredible.
And what age were you when you got interested in robotics and AI?
What age was I when I got interested in robotics and AI? I'm gonna answer this slightly differently. When I was in high school, I got interested in entrepreneurship, and I knew I wanted to start a company. I've always been mission driven. So I've always known I wanted to help people. I've always loved technology, but really, I'm not trying to build technology for technology's sake. It's really fundamentally about how can we help people. And so robotics and AI are a tool that, if applied correctly, can dramatically help billions of people. And so for me, I became interested in it like college, post-college, because I started to realize that these technologies can significantly impact people, particularly people in areas that have lower resources.
Any advice for any kids like junior high, high school who are like interested in getting into robotics and AI?
Oh yeah, do it.
Yeah.
Do it. It's an amazing field. You'll learn a ton. You'll have a lot of fun while you're building. But also just depending on who you are, don't. My advice would be, don't just build to build with a purpose, because I think that'll lead you down a more fulfilling path.
Now, do you have to be super smart, like mathematically inclined to do robotics?
I don't think so. I think there are a bunch of different ways to apply robotics. So for example, our head of product development doesn't have a software. She's an engineer, but she doesn't have a software background. But she's been super impactful in helping our team understand how to apply robotics to facilitate specialist workflows.
So, two-part question. What excites you about robotics and AI, and what scares the fuck out of you about robotics and AI?
Oh, man. The thing that excites me about robotics and AI is that a lot of people call it physical AI. It's this ability to enable specialists to treat patients who aren't in their same location or who are at a distance. And so we can just significantly distribute access to care. That's fundamentally everything that we're about at Dopl. Thing that scares me is that's a good question. Oh no, I don't get scared of a lot related to this, but I want people to understand that these technologies don't necessitate that we replace people. I think they will in certain scenarios over time, but we're not building or using these technologies to replace people. We're using them to enhance their abilities. And I think that's a really important difference that I wish more people talked about.
So how do we get that word out? Because most people think the opposite, or they think it's going to replace the jobs, not enhance it, right? Is this bad PR by the robotics companies or the AI companies? How do we, kind of get that word out there, you think?
Yeah, I think it's conversations like this. I think AI, robotics, particularly replacing people, has just been overhyped. And when you look at technology, the growth of technology, I'm still here, you're still here, we're still doing our thing, even though we have AI that we've been using for decades.
Yeah, people don't realize AI is not brand new, right?
Right.
It's been longer for decades, right? Yeah.
Right, and we're still here doing our thing. And so the same thing's going to happen moving forward. Things I think are accelerating, but there's always going to be a place for smart folks to make the world a better place using existing technologies and stuff.
I mean, you think pretty much every generation new tech comes, right? Like
Right.
the basic thing, the car replaced the horses, right?
Right. Right.
All that
Exactly.
stuff, And like I heard people compare the AI just like when internet took over, right? Everybody thought internet was going to fade, it would go away.
Right.
AI is not going anywhere.
Right. Right. So
The name, your name, come to your name. Is that like an acronym or something? Talk about the meaning of the name.
yeah, doppelganger. Um, the the premise is that you've got a physical world and a virtual world, and we're collecting data that can represent the physical world digitally, and there's people, places, and things in that virtual world, and those are our doppelgangers. And so, while you have a remote specialist performing an ultrasound exam on a patient that's over 200 miles away, that remote specialist is actually digitally present in that physical room with the patient, and so that's their doppelganger. And so
Okay,
that's how the name Doppel came about.
nice. So let's talk about this, right? So there's always like these comparisons, like rich and poor, privileged, non-privileged, right? But I think the biggest thing we just saw was this, right? I'm kind of mixed up. Like, pose like you're quote unquote a poor person in Seattle, right? And you're like a medium class or rich person in like small town Arkansas, right? I would argue you have more opportunities in Seattle because all the access to computers, internet, all that kind of stuff, right? For rural Arkansas, you probably don't, right? So how do you think, is that something that needs to be fixed, or is this the way it is, or is there a way we can fix that?
No, I think we can definitely fix that. But I think we have to change how we look at the problem. Like, for me, these problems are fundamentally rooted in the distribution or lack of distribution and power. And so, when someone doesn't live close to something, or when someone is prevented from accessing a system in some way, um, is it distance? Is it how they look? Is it the environment that they're in? And how can we change that? And so fundamentally, I think it's about the distribution of power, and we can change access by changing the way that we look at and distribute power to people.
All right, so follow-up question. Let's suppose you're in a town, we'll say Denver, Colorado,
Okay.
and there's like some rich people there. They control all the tech, all the stuff, all the access, right? And this group of people, they do events every month, right? And they want people to come, right? And there's like, say the poor part of the town, they want opportunities, right? But they don't know what's going on in the rich part of town, right? So is it the responsibility of the quote unquote rich people to reach down and say, hey, we have all this stuff going on, we're hiring, we need to do this? Or the quote unquote, less rich people to find these opportunities and go there?
That's a good question. It's also a complicated question. Like, I don't know if there's one answer necessarily. From my perspective, if I'm a person that has resources, I want to find the folks who could benefit from those, and then distribute those resources to them, so that they could continue that process on. But that's just my perspective, and I don't necessarily think that someone's wrong for not doing that. I think it kind of just depends on the situation.
Yeah, I think the problem is you have like, the people resources, they're like put them out and like, they're like, I've done all I can do, right? It's on Loom, it's on Eventbrite, right? And maybe they need to do more. And you have like, less fortunate people, you want to call it. They're like, well, I want to go, but I don't have a car.
Mm-hmm.
And the bus takes 3 hours, or it's like this and this, right? It's like, I won't say come excuse, like a reason not to do it, right? So I definitely think both sides need to like make more of an effort to meet in the middle, so to speak.
Yeah.
So what's your definition of underserved communities?
Yeah. I think there's a bunch of different ways to slice it. I think the best way for me to describe it is to just describe like what I saw growing up. And so I grew up in Kalamazoo, Michigan. The time it was a city with one of the highest black infant mortality rates in the nation, and I got to watch some work that my dad did to improve access to care in Kalamazoo, by bringing the care to the people. And so one definition of an under-resourced community is a community that lacks access to the basic health care that they need. um, and and so by bringing those resources into that community, now you've increased the level of access, and so there's less of a gap there, and so that's sort of my conceptual model of an under-resourced community.
Talk some more about the impact your dad had on you.
Yeah, I mean, when you see somebody wake up every day and dedicate their whole life to one thing, that has a significant impact on you. It instilled in me not only work ethic, but the belief that the fundamental understanding that I can make a difference, and that even if I don't get the result I want, I can inspire the next generation to pursue the same thing. And for me, that's how missions and visions perpetuate even beyond our lifetime. So I feel like my dad gave me that.
And are you married, single, got kids?
Married with an 8-year-old.
Okay, so let me ask you this. Do you consider yourself, a father, a black person, a black man, a tech person, academic person, entrepreneur, or just everything combined?
All of that, man.
Okay.
All of that. I feel like we're complex based on our experiences, and I experience all those things every day.
And then how do you prioritize all that stuff?
Ooh, it's challenging. That's probably the most challenging part of my job is prioritizing all the things that are important to me. My daughter, my wife are number one, top of the list, and then family and Dopl. Rest of the family and Dopl is after that. But there's some days where I gotta grind, and my family understands that, and so. Shout out to my wife and daughter just for the maximum love and support they give me every day. Nice.
And you have a PhD in biomedical and health informatics.
Yeah.
What in the world is that?
Yeah. It was a really cool degree. So I got to go to school with folks my background's in computer science at the University of Michigan. Put me in front of a computer, I can make magic happen. But in my program, it was multidisciplinary, and so I got to go to school with folks in public health, data scientists, just like all across the board. And so really what biomedical and health informatics is about is understanding how you can use healthcare data to make healthcare better. And there are a million different ways to do that. I focused on creating virtual and augmented reality surgical navigation systems. And so I would take all this data that already exists in an operating room and visualize it in 3 dimensions to enable specialists to understand that data better and make more precise, accurate decisions.
And when did you get interested in this medical field, all the health data stuff?
I've always been interested in it since I was young, and just going back to my family history. But really, like when I was at Microsoft. So after undergrad, worked at Microsoft, and that taught me the fundamentals of just computer science and engineering and building products in general. And then I did had some family issues that kind of changed the way that I looked at healthcare and made getting into healthcare this thing that was sometime in the future to a thing that I needed to do right now. And so then I volunteered at the University of Washington in Dr. John Gennari's lab, who eventually became my PhD advisor. And I just loved it. Like I loved every moment of it, and that was a natural segue into the PhD program.
So why get a PhD from the University of Washington against all the choices you had?
It was a perfect fit. That volunteer session that I had, the people that I met, the things that they were focused on. You had Dr. Furness, who was faculty at the University of Washington, the grandfather of virtual and augmented reality. It was just a natural fit.
So why get a PhD, right? Because I don't know if you've heard this joke that goes, if you want to guarantee 100% unemployment and never have a job again, get a PhD, right?
Yeah, I wanted to change. I wanted to pursue what I was passionate about, and the PhD program gave me the freedom to do that. And so I was far less economically focused, far more just like looking on the inside and trying to figure out what I needed to take the next step in my life.
So getting a PhD, I've heard, is not for the faint of heart, right? And I heard like half the people quit, you know. How did you make it through, so to speak?
Again, shout out to my wife and daughter. They were huge supporters. I feel like focus and passion. Like I found a project that I was really passionate about, and I wanted to finish it. I wanted to contribute that knowledge to the world, and so that's what drove me most days.
Here's one for you. So your father's a doctor, so I'm guessing you came in from like a middle income background. And so nowadays people throw around the word privilege, right? White privilege, rich privilege, right? So for people might say, well, of course you did well because you had a privileged background, right? You have more advantage. What would you say?
I would say that's absolutely right. I would say that's 1,000% right. I also had incredible parents who pushed me beyond what I thought my limits were to excel. But I had chance after chance after chance after chance to succeed. And I know a lot of people who were smarter than me that, I think were smarter than me that didn't have the same opportunities. And you may look at where they are today and see less success. And I think it's totally rooted in the opportunities that I was given and my understanding of the importance of taking advantage of those opportunities. And so that's also like why when I look at people who post things or celebrate like some success and don't thank people, I'm just like no, there's a ton of people who made this possible for you, and I think that's always important to recognize.
And so do you think your success is more like, or evenly distributed, or more based on like your genetic background, smarts, just good luck, or just a combination of everything?
All right, so let me just give you a story. So this sort of shapes my perspective. So my great grandfather was a slave, and he bought himself out of slavery, and then he bought his son out of slavery. And his son, first generation out of slavery, got a PhD. And then when you look down the family tree, you eventually get to my grandfather, who's incredible, by the way. He was an Ohio State senator. Like a state senator is in my family. His kids, so now we're at my mom and her family, all were either physicians or lawyers. My mom went to Stanford. That's where she met my dad, who also went to Stanford. And then there's me and my brother and sister. And so, like, when I think about my position, when I think about my privilege, I'm going all the way back to that moment where my great grandfather bought himself, like had the opportunity to buy himself out of slavery and then buy his son out of slavery. And I think it all started, that was a catalyst for me getting to where I am today. And so that's sort of my conceptual model about privilege. Like, it started a long time ago.
So you really had no choice but to be successful, right? Like, you would have been disowned by the family. You're like, if you told your parents, hey, I'm gonna get some 9-to-5 job working at McDonald's, they're like, yeah, son, that shit ain't gonna work. Like what the fuck you doing right now? Like you just putting the whole family line, right? Like all our granddaddy, grandparents, great grand, they're all rolling in the graves right now.
Shout out to my mom and dad. I think that's what they'd say.
Yeah. So you had some great jobs too, like, Microsoft, NVIDIA, Pluto VR. Like, how did you go about getting these great opportunities?
A little bit of luck, some hustle, and some vision, I would say. Undergrad, I went to a job fair. I wasn't even going to go. One of my friends, a couple of my friends, Remy and Pascal, who are in my engineering a group, encouraged me to go to this job fair. Took my resume, talked to Microsoft, got the job. It was pretty much happened that straightforward. And so that was a catalyst for the rest of my career. Did the PhD, when I applied to NVIDIA, they were starting this team called Clara, or actually the team that already existed. But what Clara was doing was they were building a pipeline for third-party AI models that could process medical images and run inference on them and do things like identify cancer or take measurements in the images and things like that. And so that just based on my PhD work, it was like a natural segue, really good fit into that team at NVIDIA. And then after that, when I went to Pluto VR, Pluto was building this virtual and augmented reality platform to help humans transcend physical distance. And so you could be anywhere in the world, put on a VR headset or AR headset, and then feel in person just like we are right now, even though you were very far away. And so that was just a natural fit because I had already got into AR VR, but also telerobotic procedures. And so I wanted to make a physician in Chicago, for example, feel like they were in the operating room with their patient in Seattle while they were performing a telerobotic procedure. And so natural segue into Pluto VR. And we actually built that system, that telerobotic system with AR VR telepresence while I was at Pluto to just demonstrate the future. And so I don't know, I feel like with Microsoft it was luck. With everything else, it was very purposeful because I knew exactly what I wanted to do at the time when I was looking for a job, and found people who wanted to work with me.
See, a guy Remy, he was there when y'all did the run through the Seattle Chamber last week, right?
Who?
Remy, he was there like at the chamber.
Yeah.
I don't ask him so bad. Is your last name Martin?
No, it's not. It's not.
His parents must have drunk gallons of Remy Martin.
I'll have to play this part of the podcast for him. I think you would laugh at it.
Yeah. Is there a difference between building teams and leading teams in like, academia and like the so-called regular work world?
Oh yeah, absolutely. And I think there's a difference between building teams at different sizes of companies. So just for example, like when I was doing research in academia, the people that I worked with, there were some people that I worked with where the incentives were just very misaligned, and so that taught me a really important lesson about like who I wanted to work with and why I wanted to work with them. And so then like when you look at Dopl, for example, like the most important thing is a passion for helping people. It's all about our mission, and everyone's mission aligned. And so we have this like solid foundation that brings us together. And then there's a quality of like hunger for learning that's also extremely important. That's within everybody. And so what I learned really at Pluto VR and what I brought into Dopl is the importance of culture, and for everyone on the team to be culturally aligned, so that you can really move towards or accelerate moving towards your mission vision.
And how do you know like if your culture is kind of getting off track, so to speak, and you got to reel people back in?
Yeah, I've seen people with the wrong attitude just destroy teams, and I don't know how to put it into a clear, concise, snippet for this talk, but I think it's something you just know. You just know when you see it. It's like, oh, that's not going to work.
And so at Dopl, y'all wanted to deliver distributed, on-demand, diagnostic, and interventional care to underserved communities.
Yes, sir.
Well, like, how do you decide where to go to? Like, obviously, you can go anywhere one time. So you have like a top 10 list, top 10 communities you want to go to, or how do you make those decisions where to go to?
Yeah. I think the short answer is the universe. The universe has told us and will continue to tell us where to go. The longer answer is we went out and we talked to everyone who would listen to us, listen to their problems, their need for this solution, both now and in the future. And it became very clear that rural areas just right in our backyard, right outside of Seattle, need access to ultrasound specialists like yesterday. And they'll do anything to get access. And so we just naturally developed partnerships with them, and they became our first rollout partners for the services that we sell today.
And who's your customers? Are like this hospitals? Like who's going to actually pay for this?
Yep, hospitals. Hospitals are the primary ones, and then you have sonographers who subscribe to our platform, kind of like Uber drivers, and then our platform connects those sonographers to the hospitals who have purchased our robotic equipment.
Is it like a certain size hospital, or hospitals who run a revenue, or like a hospital that specializes in cancer, or what?
Yeah, we're focused primarily on critical access hospitals. So there's 1,800 rural hospitals in the U.S. There's about 1,300 of those are critical access hospitals, and these folks they're out there. They're out there. They don't have access to many specialists, and their patients are in dire need of ultrasound.
And these items you're going to bring in, like how big is this?
Yeah, it's about half the size of this table.
Okay.
It's just a cart with a robotic arm on the end that holds an ultrasound probe. Yeah.
And how many of these do you have right now?
We've got 2 of them right now. We're currently in beta development. And then after this round we're raising, we're going to get FDA clearance and then distribute them to a small group of hospitals in Washington, validate our model, and then we'll scale up. And
where are you making it at? You have a factory you make them at your place of work? How's that happen?
Yeah, so we actually partner with third-party hardware vendors. So we're primarily a hardware agnostic software company. And we partner with third-party ultrasound vendors, third-party robot vendors, third-party controllers. Our software brings it all together, connects it to a remote specialist to enable telerobotic and semi-autonomous exams. And so fundamentally, we ship the parts to our office, we put them together, connect them to our software, and then we'll eventually ship those to customers.
And is this made out of like plastic, aluminum, steel, or does that even matter?
Yeah, no, it does matter, especially when going through the FDA. This is made out of a variety of different materials that are all safe to use on patients.
And how do you ensure like the quality is what you need when it comes back from the factory or it's actually being made at?
Just testing.
Okay.
We do a ton of testing.
Okay. And this place you got it made at, like, talk about how you found them, right? Did somebody recommend, or did you do like a due diligence on 10 different places?
Yeah. So a little bit of everything. So there are a lot of. So one of the crazy things that's happened over the last, let's say, 10 years is you've had this incredible growth in robotics. You've had this incredible growth in ultrasound devices. And we're also seeing a growth in like haptic controllers. And so these devices are now becoming commodities. And so there's a lot of different robot vendors to choose from that you can, tap into their APIs to control those robots with software. Similarly with ultrasound, there's these incredible like AI-driven, portable, low-cost ultrasound probes. Same with the haptic controllers. And so there's actually a variety to choose from. And some of them we met through just like connections that we have. Some of them we met by searching them online. There's a variety of ways.
So best case scenario, how many of these robotic things you're gonna need?
So in our first release, we're gonna go with one robot, one ultrasound vendor, one haptic controller. Our long-term vision is to become a platform. So any robot, any ultrasound, any haptic controller can plug into our software and take their product to market independently.
How does like the upkeep or like maintenance work?
Yeah, so we have a bunch of telemetry in our product, so we'll know the state of the hardware and software that we're running, and then we charge hospitals a maintenance fee, which enables us to go out to these hospitals to maintain the product.
Are you worried about, like, you send it to a hospital in like rural Mississippi? Like, this is a bad way to say it, but are you kind of scared or concerned like those people at the hospital won't be able to like get it and be able to run it?
I'm not worried about that.
Okay.
We've spent a lot of time working with folks in those areas, particularly out in Washington, but similar environment, to really understand and design a product that works effectively there. And so we're not worried about that scenario. It would take a lot of time to make sure that doesn't happen.
And do you need like Wi-Fi electricity, or is it battery operated?
No, we can operate it over battery. We actually did this cool study with thing with T-Mobile where we put our system in an ambulance and it was running off battery and 5G, and we drove around Bellevue and a specialist performed a remote robotic ultrasound exam on me in the back of an ambulance. And so, like, we can do this in a moving vehicle. We can do this at land, at sea, or in space. Initially, we're focused on plugging into a wall in a rural hospital through land and 5G and doing it that way. But eventually, this will evolve into some really cool shit that I'm excited about.
Do you see any community out there that this would not work for?
No.
Okay.
No. We're about everybody. We're initially focused on rural communities, and so we're designing it for that environment. But over time, as we expand to people who have different needs, we'll design systems for them.
So you do talks on healthcare, robotics, AI, imaging. Can you just talk about a recent talk you did?
Ooh. Yeah, I mean,
let's get up just a little bit.
Okay. Yeah. I spoke at UW not too long ago, just to a group of students who were looking for what they wanted to do in the next phase of their career, and that was a really cool talk because I got to talk about my history and also just like figure out what the next generation is interested in, and we just had some good conversations.
So, why do you think the U.S. health system, I won't say broke, but like so quote unquote so different from everywhere else, right?
I think the economic incentives, the way that we reimburse, the lack of transparency, the fee-for-service model, all influences how healthcare is delivered, because that incentivizes companies in different ways, both on the device side, the provider side, the specialist side, and so when you look at our model versus like Canada or other countries that have different payment systems and reimbursement systems, public versus private systems, it just dramatically changes the incentives and how healthcare is delivered.
One thing I never understood was like, you're the doctor says you need X whatever. The insurance company come back and say, no, you don't need that. Like, what? Like, the doctor says I need this, right? How you the insurance company says it's not covered, right? With the clinical areas. I just never understood. I never got that,
Yeah, it's crazy. I think we don't understand in part because that gives the insurance companies more power to dictate where money goes. And I have a very cynical way of viewing it, I know, but I think that's one of the reasons, and it's unfortunate because that results in a lot of people not getting the care that they need.
Do you think we can ever get insurance companies out of this medical thing, or is this just some evil we have to deal with?
Oh man, I believe we can completely tear down the systems that exist and rebuild them to support everybody. But I think it's going to take a lot of work and a lot of people moving in the same direction to achieve that.
So I got a story for you. So I was in Vietnam from November to February this year, right, or last year, right?
Okay.
We're doing business, doing different things, right? While I was there, I hurt really bad, right? I pulled my back muscle, right?
Oh man.
And so a week long, I'm trying to be tough. I mean, I got to go to the hospital, right? We were to the hospital, right? And so went online at 9 a.m., had an appointment by 11 a.m., saw the doctor at 11 a.m. He saw the doctor, he looked me over, got an MRI, came back to the doctor again, got my medicine, was done by 2 p.m. So the whole process from 9 a.m. to 2 p.m., online everything, $135. For medicine, MRI, I'm not a fucking communist, but man, maybe we need some lessons, right? Like an MRI alone would be like probably $10,000, right? Over here, or something like something crazy. Medicines alone, right? Yeah.
Something crazy. So crazy juxtaposition. One of my co-founders works at Harborview. He needed an ultrasound. Took him 2 weeks. 2 weeks to get a cardiac ultrasound because he was feeling shortness of breath. Like, that's crazy.
Well, I'm retired Army. Everyone has to say, "Oh, you're Army free medical care." Yes, it's free, but so when I came back to Vietnam February 10th, I said I needed a follow-up, right? So I got on the VA line like February 15th. I didn't get seen like maybe May, like 3 months later.
Yeah, it's nuts.
I have a pull back still, right? You're like, yeah.
It's unfortunate. It has to change. It has to change.
Everyone says it has to change, but how do we change it, right? I mean, of course, the people in the power make money that I want to change because, I mean, it is what it is, right?
So one of the ways that we're doing it is we're forcing people to change by building an economic model that lines their pockets. Like that's the method that I've seen that gets people to move very quickly. And so for us, it's like you've got a bunch of specialists, you've got a bunch of patients, they're not connected, and so care happens really slow. We're going to redistribute those specialists so now they can treat patients on demand, which is going to increase revenue for specialists, it's going to increase revenue for hospitals, it's going to decrease costs for payers, and so everybody wins. And in that scenario, there's significant incentive to get patients the care that they need faster. And so we've really built our mission into our business model, and that's what's going to drive change. And I think that's not like a panacea. That's not going to solve all these problems, but I think it's a start.
So I think another challenge too. A lot of these doctors, they're getting up in age, right? All these baby boomers are going to retire pretty soon, and no one's taking their place. But my thing is like, why would anyone want to be a doctor? Or like, why would someone like a junior college like, man, I want to be a doctor? Oh crap, that means $500,000 of debt. It means this. It means that. Don't insure. Like, why would anyone with any kind of clear mind want to do that?
Yeah, that's why I didn't. I saw my parents working crazy hours, getting up in the middle of the night because they were on call, coming home, falling asleep on the couch because they were dead tired. Like I had zero desire to be a physician.
But we need doctors, right? So how do we incentivize people? You know,
I think we improve their work-life balance. I think we improve their work-life balance and make it exciting again to become a physician.
Yeah, because you always hear this, like you hear the TV shows, like, hey, Jason Cavness is a resident. He has to work 20 hours a day for 22 weeks, right, with minimum wage. You know, like of course it's like exaggeration, but like it makes it like all these doctors have to go through hell to become a doctor, right?
Yeah.
And just because you had to go through hell doesn't mean people behind you have to go through hell.
Right. It's crazy.
So what do you see as the future of healthcare?
Oh man, I see it. The future of healthcare is distributed. It is powered by cutting edge technologies, and it's efficient. It's efficient and low cost. I see all of those things in our future. But I think it's going to take some innovative companies pushing the bound, not just one. Some innovative companies pushing the boundaries in a concerted effort to get there.
Here's a question for you. I've asked this podcast before, and I think it really aligns with what we're doing. Like, suppose someone has under surgery, right? And they have a choice between a human or an AI robot. Which one should they pick?
I'll tell you what I would do.
Okay.
I would choose. This is an interesting question. I would choose the robot.
Okay.
But in the right environment. I think the fundamental, but also like I just want to level set for a moment. I think that AI robots will be able to do fully autonomous care delivery in the future. Like there's no doubt in my mind about that. I think the progression to get there is through telerobotic exams and sort of human in the loop, humans driving robots to perform exams and procedures, and then semi-autonomous exams and procedures, and then eventually we'll get to full autonomy. But that, I think there's a chasm between semi-autonomous and fully autonomous exams and procedures, and you've got to find the right market that absolutely needs full autonomy, and then you start there, and then that will be a great segue back into the mainstream market, to then adopt full autonomy. And so that's sort of why I paused there, because I'm thinking through all that.
So I think like this. So pretty much everyone else asked a question too, all of them said human, right? But then they'll follow question, okay, you pick human, but what if that human graduated last in his class and has malpractice lawsuits against him, right? Immediately the robot.
Yeah. I mean, I think there's humans are prone to error, and robots are only going to do as well as they're trained to do, and so it's not like it's a perfect solution, but it's more deterministic, and I think that's beneficial. I also just, every time I talk about this, I have to say, like, I don't want to lose sight of the value of people, because they're the ones that make this all possible. We make this all possible.
So I saw a study, and I wish I could quote it and where it came from, but a basic study compared, like, they did like medical, what's that thing called? Like someone's sick and you got to do a diagnosis, medical diagnosis, right? And it was an AI or a person with AI, right? Yeah. AI got a rate like 92% of the time. The person by himself got a rate 60% of the time. Person AI only 64%. So even the person with AI didn't trust AI, right?
Yeah.
So I don't know, like, man, is AI really that right most of the time, right? It's like it kind of scares you, right?
It varies, and it depends on the problem as well, and how much data we have, and the models that have been trained to solve that problem. So it's complicated, but eventually, I think we'll get to a point where, with more and more things, AI will be able to do it as good or better than people, and so then it really becomes like the market conditions that influence the adoption of that AI, and that's the critical part that I'm focused on, is like finding the right market to introduce these solutions into, because that's gonna drive adoption.
Suppose you're in some hospital, there's like an elderly lady, the elderly couple, and they're like, I'm not doing this. Like, ain't no robot coming towards me. Like, how do you convince them like this is good for them? Or you just put a human on her, so to speak.
Yeah, I mean, I feel like some people just aren't ready, and I think that's okay. Like, people need to be given the choice to make their decision. And if that person would rather drive 4.5 hours while they're experiencing shortness of breath and wait 6 months to get a diagnostic exam to figure out what's going on, like, so be it. That's up to them. But we're for damn sure gonna put a system in their hospital so that they can get care on demand, so that they can make the choice themselves.
And are you in a town called I can't say it. It's ILWACO, Washington?
Waco, yeah.
How did you decide to go to that specific town?
Shout out to my co-founder, Dr. Steve Sussler. He's an interventional. He's not an interventional. That's my other co-founder, Dr. Masi. He's an interventional radiologist. Dr. Sussler is a cardiologist, electrophysiologist, and we're doing some early telerobotic heart procedures. And we partnered with Larry Cohen, who is the former CEO of Ocean Beach Hospital, which is in Owaco, Washington. He's this very forward-thinking rural hospital CEO. We started doing some early testing with them, and did all these studies with them, developed a really strong partnership, and then so when we pivoted from that minimally invasive heart procedure to ultrasound, we just continued that partnership, and so that's how we.
And where's this town at in Washington?
Ilwaco, Washington.
But where's it at?
Southwest Washington.
And so, like, I'm guessing that's some kind of marketing plan. When you target a hospital, we'll say like whatever town in Washington, like, what's the marketing plan? Like, do you reach out to the CEO of the hospital, like a chief of operations? How's that work?
Yeah, so the CEO, CFO are the folks who are going to make a decision on a purchase or whether to work with you. But then immediately they're going to go ask their clinical staff, so the chief medical officer, chief innovation officer, head of imaging, etc. And so what we found is starting on the clinical side, making sure the clinical teams are all aligned, and then having them take us to the hospital leadership has been the most effective path for us.
And like, how do you decide what hospital? I kind of asked you this before, but how do you decide what hospital to go to?
Just based on need.
Okay.
We're looking for folks who have a hair and fire problem, have no other solution, and are in desperate need of access to diagnostic ultrasound. And so those are the critical access hospitals in the United States. So that's who we're initially focused on.
So change up a little bit. So what's something you've done in the past that you're proud of, but it's not public knowledge, right? It's not on your resume, not on your LinkedIn.
Yeah.
Like, of course, your wife knows about it, your parents, close friends, but like even people on your Dopl team don't know about it, right? Something like you're really proud of that you've done in the past.
Yeah. I'm gonna take us back to high school. So shout out to Andy Pollins, one of my best friends growing up. He got me into like peer-to-peer downloading, and so I would download like bootleg PlayStation 2 games and burn them onto CD, and then I would go to my school and get people to give me their PlayStation 2s, and I would open up their PlayStation 2 and then solder a clothespin to it so you could unlock the CD tray. And then so what you would do, and then I would close it back up and give them the PlayStation 2 back. And so what you would do is you would put a Game Shark in, you would start the PlayStation 2, and then when the Game Shark reached a certain screen, you would unlock, using the pin, unlock the PlayStation tray. And so the PlayStation didn't know it was actually unlocked. It thought the game was still running. And you take the Game Shark out, you would put in the copy game, and then you would close it up, and then your copy game would start playing. And so I was always really proud of that because it showed me that you can create a new market by giving someone this tool, and then they need to come to you to buy like the copied games. And so that's a way of like cornering a market. And so I was always proud of that, even though
you're like, this entrepreneur stuff might actually work for me.
right, exactly.
Yeah. So there's a lot of stats out there. Like one stat in front of me, like globally, 5 billion people like access to care. There's all these stats out there, but like how reliable are all these stats? Like what are these like stats can be like made like, for both sides, right? Like how do people know these stats are reliable, and where these stats come from?
Yeah, I think it's challenging when you get into giant numbers like that. To like really know the specific details. When I look at stats like that, I'm just thinking like there are an incredible number of people who don't have access to care, whether it's 5 billion or like there are billions of people who don't have access to care. We can be confident in that. And then I think you got to do your own research. Like we went out to different countries. So for example, we talked to hospitals in Kenya and Tanzania where the access to specialist problem is like 10 to 100 times worse than it is in the US. Reimbursement is similarly 10 to 100 times lower than it is in the US. And so just the challenges in that environment are completely different, which for me just illustrates why, there are a lot of folks who don't have the same level of access that we do.
Is healthcare, or should healthcare be like a basic human right?
Oh yeah, absolutely. I think so.
Why?
Because it dictates our opportunity to not only life, but to do everything else. If you can't get out of bed in the morning, then because you're sick, like that prevents you from living a complete life. And I think everyone should have access to the healthcare that they need. I think everyone deserves that, and the way that we're trying to achieve that is by making healthcare low cost and distributed to everyone, so that just by default you have it.
Is there like a specific medical situation or certain specific patient care problem that like inspired this Dopl to start?
Yeah, I mean, for me, it was my grandfather. He had cancer, and this is while I was at Microsoft, so around 2011, 2012. And I remember going to his doctor's visits and looking at his medical images. He had pancreatic cancer, and I remember looking at his medical images just like, I have no idea. I have no idea what I'm looking at. I have no idea how I can help. And so I felt helpless. And shortly after he passed away, that just was a trigger in me, just like, I can't keep working the job that I'm at because I'm not helping anybody, but I have all this knowledge and I feel like I can apply it to make a difference. And so that was the catalyst for me.
So how is Dopl like measuring success beyond revenue? Is there certain KPIs you're tracking or certain impact metrics that matter most to y'all?
Yeah, a couple of them are, to date we've scanned almost 1,500 patients in rural areas. We've decreased wait times by from 6 months down to about a week in some cases, and so really having an impact on people accessing the care that they need a lot faster. Those are the metrics I'm most proud of right now.
And you have like one person dedicated on your team to track all this stuff for you, or are you relying on like hospital stats?
Both.
Okay.
But we've got a person on our team that's tracking all this.
And let's talk about your co-founders. How many co-founders are on the team?
Excuse me, 2 co-founders.
And like, did y'all like lifelong friends? Like, talk about how the relationship started. Because you know the thing, co-founders are more important than your marriage, longer than your marriage. You know, for like, if you don't have co-founders, you fail. But if you have co-founders, you fail, right? So talk about that process, please.
Yeah. Shout out to Steve and Wayne, Dr. Sessler, Dr. Monsky. I mean, it all started around technology. We're all a bunch of nerds who love tech and love helping people. And so I remember the first time I met Steve. It was actually at CoMotion on the University of Washington's campus, and he came in and we just started talking about the procedures that he performs every day and the things that he wanted to do to improve access, and distribute his skill set to people who are further away, the things I wanted to do to use technologies to enable that. And these are his words, not mine, but I share them, which is like, it was like love at first sight. It was like, we've got to work together to figure something out. And then he's just an incredible person that challenges me, but also is, you know what I mean, like is willing to, see flaws, but also help you enhance strengths. Just like someone in a marriage, and Wayne's the same way. And so couldn't say better things about my co-founders and the folks I get to work with every day. So
don't tell the details, but talk about the process, like how, like the equity part. How do you decide who got what part of equity, and like how do you decide like you would be the best CEO?
I would say through trial and error is the high level way to look at that. We just started working together and just naturally fell into roles that worked for us. And then when it came to equity, we just had honest, open discussions about what we were looking for, what we thought we could contribute, and how that equaled an equity amount, and then we all just settled on things we were happy with. My personal goal was to decide on numbers and never think about them again, and we've been pretty successful in that department.
And was this like a 2-month process, 2-day process?
I mean, we had been working together for like 5 years before we started Dopl, and so hard to say specifically, but I think when we started talking about equity, it probably took a few months to just hash things out.
Yeah, I think the biggest advice there, a lot of these founders like they decide like in one day, right? You got to take some time and like process. You got to you like think through it, right?
Yeah. That worked well for us, taking the time to think through it.
So right now, what do you think are the biggest gaps in healthcare that tech is not solving yet? What should tech be solving that they're not solving right now?
I mean, I'm obviously biased in thinking this because this is why we started Dopl, but just access. Like, I think when people think about access, they think, oh, this person is like trying to solve world peace and it's all like flowers and rainbows. But nah, man. Like when you think about it, like Netflix was solving an access problem. Like Blockbuster with brick and mortar, you could only get them if you were close by. You had to drive to get there. You had to wait in these long lines. And then Netflix came around and made media accessible to everyone on demand from the comfort of their home. And that's why Blockbuster was like 8 billion market cap and Netflix was like 300. And the same thing is happening in healthcare. This isn't just about helping people. It's about the economics that are going to drive helping more people. And so I feel like more folks should be focused on. Maybe that's not fair. I think it's really important to focus on access. That's what I'll say.
So far with building your company, is the hardest part being like all the regulations you got to deal with, the medical regulations, the fundraising, finding the talent, or something completely different?
I mean, for me, the hardest part is just mental health. There's a million and one things that are happening every day, pulling me in different directions, both inside and outside of work, and a million things that are important to focus on right now that can't wait. And so finding space for myself to make sure I stay mentally healthy so I can show up and do those things and be there for my people is most important. I don't know if that answered your question directly, but that's how I'm thinking about it.
So how do you do that? How do you take care of yourself?
For me, it's I bike. I try to bike like four times a week, and then I try to play soccer a couple times a week. Shout out to Red Tide, GSSL team that I play with. I played with them last Sunday. I scored a hat trick in the first half. I'm still feeling pretty good about that. But those sorts of things.
And you're like a lifelong soccer player?
Oh yeah.
Like since a little kid?
Yeah, since I was I think like 4 years old.
Okay.
Yeah.
And this is like some kind of intramural league you play for right now?
Yeah.
Okay. Every Sunday y'all play?
So I used to play with them every Sunday. I used to be on the team. But now I'm just a sub. The first time I hadn't seen them in like, I don't know, like 4 years. But I just subbed for them this past Sunday.
So I'm guessing you excited about the World Cup coming here to Seattle next summer?
Oh man, I can't wait.
Yeah, I can't imagine how much those tickets are gonna be though.
It's gonna be crazy.
Yeah.
I went to the World Cup in Brazil in 2014, and that was a crazy experience.
In Brazil, I can imagine doing that in Brazil.
It was wild. It was great. And so I'm super excited about the World Cup coming here. And yeah, I can't wait.
Yeah. So what's your advice to someone out there? It could be a founder, anyone, whatever, and they're like on the verge of burnout, right?
Yeah. This is a really important topic to me. So for me, it's hard to say because everyone's different. So for me, it's important to find your tribe, I guess, is what I'll say. I've been fortunate enough to go through Techstars and have some incredible founders there that I've been able to lean on in when times got tough and ask for advice. I've gone through medtech innovator and mass robotics accelerator, and just been a part of great communities both in Seattle and in California that have provided me some great support systems. Some of our investors have actually created sort of round tables that brought their founders together to support one another, and so that has been really beneficial for me, is just to talk to other founders who have been through it and lean on them for help when I need it, and reciprocate when they need it.
So these accelerators that you go to, or other founders go to, of course you hear about YC Combinator, Techstars, all the like so-called platinum ones, right? But I think like a lot of these accelerators are not really that good, right? Like I think Techstars or YC gives like, I'll make this like $200,000 for 5%. It's not really a good deal. But other ones out there give you like $20,000 for 10%, right?
Yeah.
And like, is that really the best thing for a founder, right? Like, I think there's such a thing as a founder going through too many accelerators.
I think it depends. I think it depends on the company you're building, the stage you're at, what you need as a founder. So for example, like we went through Techstars, gave up somewhere between 7 and 9%, and I'd do that again a million times over. So when I say I'd do it again, if I were given that same decision back then, I would make the same decision 10 times over. It was an incredible experience for us. It was the catalyst for building Dopl. Like, shout out to Matt Kozlov, the former managing director there. It was amazing. I probably would not go through Techstars again in the future, because I feel like I've learned what I needed to learn, and I built the network that I needed to build that I did not have back then that Techstars gave me. And so that's why I say I think it really depends on like who the founder is, what their network is, what they've been through, and what they need that a Techstars or a Y Combinator can or can't give them.
And you're building Dopl here in Seattle?
Here in Seattle.
So give us your take on the tech startup scene here in Seattle, pros and cons.
Oh, it's incredible. We've got incredible talent, incredible support system. We've got the right ecosystem as a whole in terms of customers and people with capital, and it's an incredible environment to be in. I think there are better environments to raise capital in. For example, like San Francisco, hard to beat. And like out on the East Coast as well, like Boston, New York, particularly for medical devices. But there's definitely capital here to raise as well. Shout out to Seattle Angel Conference, Flywheel, Alliance of Angels, Life Science Angel. Like I'm a big fan. I'm a big fan of angels. We have an incredible angel community here. So yeah, Seattle's great.
So what's your advice to someone out there, they're trying to fundraise and they don't know anyone, right? They always thought these angels, people invest they have no connection, nothing. You just tell them to go to networking things, like sign up for Angel Alliance of Angels, settle Angel Network. What do you tell them to do?
Yeah, so for me, that was one of the values of an accelerator is that we went into Techstars and then immediately opened up our network. Because now we were one introduction away from a ton of angels and investors. And so one option is to go through an accelerator, which was valuable for us. Another option, like you said, is to just get out there and talk to people. You've got really high net worth individuals right here in Seattle who need to invest their money to diversify their portfolio. And so they're like looking for opportunities to not give away, but to invest their capital. And so you could be one conversation away from an investment, or one conversation that starts building a relationship that can lead to an investment or an introduction to an investment. So I would say just get out there, start networking. Yeah,
what's that thing? You miss 100% of the shots you don't take, or something like that? Yeah.
Exactly, yeah.
So realistically, in 10 years, what do you think AI role is going to be in the surgery room?
Oh, I think it's gonna drive more and more critical functions. I think we're going to have fully autonomous care delivery. I think semi-autonomous care delivery is going to be ubiquitous. And I think that the clinical ecosystem, clinicians in particular, are going to be even more comfortable with adopting AI than they are now.
So let's suppose, I don't know if you play lottery or not, but let's suppose you play the lottery tonight and you won like $100 billion.
Yeah.
You get unlimited funding. What would you do with it? Like, would you like try to get FDA fast track clearance? Like, what would you like? You go all out.
Yeah, I would. Did you say 100 billion?
Yeah.
If I had 100 billion, oh man, there's a lot of things I do. One of the things that comes to the top of my list is I'd start a fund that specifically invests in founders of color building medical device companies. There's a massive gap in the market, in the investment market there. And I think there's a ton of talent out there that's just being overlooked, and we have to address that.
And what advice you have for PhDs wanting to do the same thing as you're doing, starting a company? Don't.
No. I mean, I don't know. I think sometimes I look at myself and wonder if I'm like some sort of masochist or something. Like I love pain because a lot of the startup journey is that, and so I would just say follow your passion. Honestly, whether you're a PhD or not, I don't care if you have a bunch of degrees or zero. Follow your passion, and if that passion leads you to entrepreneurship, then go after it. And if you decide to do that, it's all about just taking the first step. Like, just take that first step, and let your journey after that take you where it does.
So I have to imagine what you're doing. There's all kind of medical regulations. I'm guessing most of them they actually need, right? But is there any like medical regulation like you're like, man, this is some bullshit. Like, we need to get rid of this. This actually holding up progress.
Yeah, I mean, there's just a ton of documentation, like documents after documents after documents that we have to fill out to demonstrate that we, are checking all the boxes. And I see the benefit of a lot of that stuff. Totally see the benefit for a lot of that stuff, but I wish there was less of it. It would be nice if we could get to a point where we could safely release a medical device at the same speed at which we release software and services to consumers. And I think it's possible through data standards and testing frameworks that can validate things as they're released, and that facilitates faster approvals. And so I think it's possible, but I think it's challenging the way the system works today.
So would it be easier once you go to like England, France, Canada to do this?
Maybe. I'm less familiar with those regulatory bodies than I am the FDA, so it's hard for me to speak to that. But certainly there are parts of the world where the regulatory hurdle is less than it is in the U.S., and that can speed up time to market.
So what's your personal goal for yourself? What do you see yourself like? You would be like, I don't know, like running $100 billion company? Do you just want to like make a little bit of money? Do you like want to like become president of the University of Washington Medical School? Like,
yeah, I have a lot of things that I want to do in the future. Right now, I'm really just focused on Dopl. I want to build a great generational company that helps a lot of people access care and fundamentally redesigns the way care is delivered. That promotes access not just for ultrasound, but for all types of diagnostic exams and interventional procedures.
And how many people are on your team right now?
Oh, we got 7.
7?
Yep.
You plan on growing anytime soon? 7 is like the magic number right now.
Oh no, we're gonna grow. We're gonna grow very soon. You'll be hearing an update from us in the next month or 2.
Okay. And like when you bring people on the team, are you looking for certain characteristics, certain values, certain skill sets?
Yeah. Going back to something I said earlier, are you aligned with our mission and vision? Like, why are you passionate about helping people? What's your growth mindset? I care less about knowledge you have today and more about ability to acquire the knowledge you need to get the job done. And then specifically like what we're going to be looking for really soon is full stack, back end, computer vision, and roles in that space. So more to come there soon.
Can you don't have it with you, but can you like kind of talk through what your demo is going to be about on July 30th?
Yeah, super excited about that. We're gonna bring the whole setup, so the expert site equipment and the remote site equipment, and then we're just gonna be doing telerobotic ultrasound exams throughout the day. So I'll have a remote person holding a controller, and as they move that controller, the robotic arm holding the ultrasound probe will mimic their movements, enabling them to telerobotically scan a patient on the table. And we'll have a phantom there, but then if you're lucky and you get there and talk to us, we'll likely be scanning a person as well.
Oh wow, that's gonna be so exciting. So I think you said you won it's a show called the Pitch Show or the Show Pitch.
Yeah, the pitch.
You won that, right?
There weren't necessarily winners or losers, but we got funding.
Okay, so you won. And then you recently won a thing called the Shit Pitch.
Yeah.
Can you talk about the process of like having a pitch so good that actually like gets you funding and winning? 'Cause a lot of people to go pitch like not the best pitch, right? Or they pitch just to put themselves out there, right? But it's like you have the mindset like I'm gonna go pitch, I'm gonna get something out of this, right? Can you talk about that mindset?
Yeah, I'm competitive. When I want to win something, I do, or I learn from it and I win the next time. And so, with the pitch, it was really about understanding the process, connecting with the people there, and understanding what they needed to hear to get comfortable with an investment. And so that's the mindset I went into it with, and seemed to work pretty well.
So I'm gonna guess like if the competition was on Tuesday, you didn't like do a run through on Monday, right? Can you talk about the process, like how long you prepared, like how many practices you did?
Yeah, just months in advance. So one of my friends, shout out to Jason, he had previously received an investment through the pitch, and so he introduced me. He coached me up, helped me understand how the game worked, and then I crafted a pitch, practiced it, and then on the day I did a pretty good delivery and things worked out.
And you also belong to an organization I think it's called Venture Black.
Yeah.
Can you talk about that? Because Evan was on the podcast a little while ago.
Yeah. Venture Black's incredible. So watch Evan's talk to find out more details. But they're a nonprofit all about bringing together Black founders and funders who want to invest in those folks. And so, I think it was last year, I did the inaugural Dream Word pitch event, where it was a pitch competition, and Dopl ended up winning. And so that was the first time Venture Black, they were called something else at the time, but first time Venture Black invested in a company. And so for me, that this is important. It opened my eyes to the fact that there are other folks who see this problem and want to help underrepresented founders get access to capital. And so shout out to Venture Black.
So how did you decide like how to spend time with pitching versus building your company versus everything else?
Yeah. It depends on what our strategy is. So for example, like at the end of last year, we raised some capital, and our goal was to reach a really important milestone, which was build a beta version of our product and evaluate it with our customers. And so during that phase, I was like, forget fundraising, like I'm focused on engineering. And so I was in the lab every day working with my team, building the next iteration of our product. And then after that, we hit this critical milestone. Now it's time to share that with the world and show people how big our company is going to get, how many people we're going to help, and raise capital based on the milestones we just achieved. And so, very strategic, I would say, but it really depends on the state of the company.
How does this work, right? Let's talk about medical malpractice, right? Let's suppose like someone is using your system at a hospital, and a patient like, man, they did something bad to me, they caused cancer, or whatever it is, right? Like who, I won't say gets the blame, but how you figure out is it like, is the hospital back to you, hey, your systems jack this person up? Like how does that go? Like, and how do you protect yourself? I guess you have insurance or something, right?
Yep, insurance and fundamentally, like the way exams work today is you've got a specialist, they're holding technology, it's in between them and the patient, and then that patient interface or that technology interfaces with the patient. And so when as a medical device, when you get FDA clearance, you're approved for your technology to work within a very specific set of requirements. And so to the extent that you can track how your product is performing and demonstrate that you performed within those requirements, that will help you build an argument in the case that you're sued and things like that.
And you have a patent for all this stuff, or do you need a patent?
Oh yeah, we have a patent. We have one utility patent that was filed last year. We have 10 more patents that are in process right now, and so we're always actively developing IP as we go forward.
So right now you're going off, I guess I just say the rural market, right? Is there any market out there you're not expecting that might come to you? Like a time I found like do go after market and then something will come out of the blue, right? Oh shit, I never thought about this over here, right?
Yep.
Any thoughts on that? Like the market might just come out of nowhere that you're not expecting. That might even be medical related.
Yeah, just stay open. Mm-hmm. Like we keep we try to maintain an understanding of all the market dynamics. So what are all the companies? What are all the regulations? What are all the how are people thinking about these different technologies, like et cetera, et cetera. So just stay tapped in on the market. Always be talking to our potential customers, but then like also stay focused. Like we have a vision for where we want this to go, and for very strategic reasons, rural is the best place. But like if we can be convinced otherwise, there's a better place to start, or something like that ultimately leads to our vision. Like we got to stay open to that.
Yeah. So what's your take on this, right? What day to day, like I'll make this up. Suppose you have 100 things on your list, right?
Yeah.
How do you make sure you focus on items 1 and 2 versus 96?
Yeah.
Like that, what's it called? The shiny something syndrome?
Yeah. Yeah. There's a quote from Warren Buffett, where he's like, create a list of 25 things and prioritize them. Take your top 5 and then throw away the other 20, because the other 20 are going to distract you from your top 5. And that really resonates with me. And that's sort of the mindset I try to go into prior.
Because usually things 6 to 25 are kind of easy to do, right?
Exactly, and they're
and then you get that dopamine mix fix, you know.
Yeah.
I've actually done something. Well, no, actually you haven't.
Yeah. Exactly.
Actually you haven't.
Exactly.
Are there any rules like on like B2B medical sales you have to follow?
One of the big ones is that we can't pre-sell a device before it's approved.
Okay.
And so like for example, we have an LOI from the Rural Collaborative of Washington, which is they represent 28 rural critical access hospitals in Washington State. We have a letter of intent from them to purchase ultrasound services, and we all know what those ultrasound services are going to be in the future. But we specifically can't call out our telerobotic ultrasound system in that LOI, because that would be a pre-sale of a medical device.
So you mainly go to hospitals, but are there like nonprofits you can go to, like any nonprofit medical things out there you might be able to use it for?
Yeah, I mean anyone where we're specifically looking for folks who have lack of access to a specialist, and so And so like some health systems, for example, are nonprofits. Nonprofit.
I didn't know that.
Uh-huh. And so we've talked with a lot of them who are interested in what we're building.
And like, I'm going to presume that this isn't like $1.99, thing you're selling. How did you figure out the pricing model? Or are you still figuring that out?
Talk to our customers. So we've got a pricing model. We've talked to multiple of our customers about it. And we'll pressure test that once we get FDA clearance and roll it out, and then we start receiving checks. But we're confident that our model will work in the environment that we're selling in.
Is it gonna be like a subscription model, or they pay for it up front and you're gonna charge like upkeep later on? Or?
Yeah, there's an installation fee for the hardware, which is basically a pass through for us because we don't build the hardware. There's a per exam fee that we rev share, so the hospital pays us. We rev share that with the remote sonographer and the remote reader, the remote physician providing the diagnosis, and then we charge a subscription fee to the hospital just for maintenance.
So the hospital, they need like certain kind of hardware system, some kind of like software, Wi-Fi setup?
Yeah, so we provide them a turnkey solution. Okay. Because these are hospitals that are going from 0 to 1. They have no services today. And we're helping them build out their ultrasound service line. And so we provide a turnkey solution for these folks.
And these remote people actually doing the service, like how do you qualify them?
So they're sonographers. They've gone to school for 2 or 3 years. They've been certified to practice across all states in the U.S. And so they've already been pre-qualified. Okay.
And then like your software developers, like software development changes so much, right? How do you make sure they keep up the skills they need, right? Are you like paying them to go to school, or is this on their own? Like how do you make sure they're,
Yeah, I'd love to be able to offer educational programs, and so with this next capital that we're raising, I'm looking forward to being able to offer that to some of our employees. But really, for me, as I mentioned, like the people we look for have a growth mindset, and so I want that to be inherent, like someone who's hungry to learn what they need to learn to get the job done.
Okay. How you do this, right? Like, someone gets out for your how you run a business. Do you have an open door policy? Can people come to you anytime they want to with the problems and challenges, or you're like, go see the other co-founder?
No, absolutely. I try to keep a tight relationship with everybody on the team, which is possible right now because we're only 7 people. I think it's gonna be harder as we scale, but for right now, like everyone in our company has a direct line of communication to me, and that's what I want.
So how do you do that when you join, like, let's splash the table, you raise all this money and you hire like 100 people, like how do you keep that culture the same, right?
Yeah, lean on founders who have been there before. So for example, one of our previous the Tacoma Venture Fund, local to Seattle.
Yeah, Dennis Joyce.
Yeah. Okay, they led our last round.
Okay.
And they have this event that they throw every year where they bring all their founders together. Some of their founders have built companies with hundreds, I think even thousands of employees, and I got to hear their perspective on some of the challenges they face, and a lot of those challenges around just communicating with the team. And so I'm looking forward to Dopl getting to that phase, and then me being able to lean on folks who have already been there to get advice, so that I can try to avoid some of the challenges that they face.
I think it's a challenge too. Like I think a lot of people in charge, I don't care what it is, business, whatever, they're like, yeah, I communicate everything. But you ask the people, like, what? What are you talking about? He's never said that. Or maybe I said it one time. I sent an email out, dude. Like, are you kidding? Like, you got to communicate over and over and over and over again, right?
Yeah, which can be challenging.
And because you think, like, even like when you're pitching, right? You're like, man, I've said the same pitch 10,000 times. Yeah, but not to him.
That one resonates with you.
Not to him. Yeah. And then how you do this, right? So let's suppose you talk to somebody at your company, or investor, or whoever it may be, right? And man, I gave a detailed pitch, everything explained, like, and the person says, I think you do this, and someone completely left field, right? Are you like, man, this guy must be dumb as fuck to not understand this, or like, no, it's on me because obviously I didn't communicate the right way, right?
I feel like I've evolved from blaming the other person on the other side of the table to trying to look at the situation objectively and figuring out how I can, because I can't control.
Like, damn, like it's a kindergarten level. I gotta go to pre-K level. I think everyone has a challenge though, right?
Yeah, I think so. I think so.
Like, how do you not get this? It's like 2 + 2 is 4.
Yeah.
Like, what are you doing? Yeah.
Yeah, and the challenging part is to really understand why and try not to over-index on the person who doesn't understand because they weren't listening versus the person who didn't understand because your message wasn't clear. You know what I mean?
So let's talk about founder advice, right? So like you have all these people on your advisory board, different people helping you out, Evan Poncelet, Dennis Joyce, but all advice ain't good advice, right? So how do you decipher like, okay, thank you, but I'm gonna go a different way?
Yeah, I feel like that's one of my strengths, which is I love getting, I love drinking from the fire hose. Like I want a bunch of people, bunch of smart people around me giving me advice, and then I will filter that advice and make the best decision. I feel like that's just something that
That's a great skill to have.
that I've developed over time.
What's like a pet peeve of yours?
Ooh, what's a pet peeve of mine that I'm gonna revise that I want to say over on this podcast. That's a good question. I don't know. I don't know how I would answer that question.
I'll tell you mine. It's related, but like if I had like dirty clothes, I don't care on the floor. Like suppose I take some of the washing machine and falls on the floor, I just go batshit crazy, right? I can't stand for anything, any clothes or clean to be on the floor, right? Just drives me crazy.
Yeah. I'm laughing right now because before I came here, I took my clothes out of the laundry and I went upstairs and I was rushing out, so I just dumped them on the floor. Up the basket. So you probably hate me right now.
So let's suppose someone's watching this and like, man, Ryan just says he's gonna be doing some hiring pretty soon, right?
Yeah.
And their whatever skill set is marketing, operations, whatever it is, like, man, I want to get involved with this. Like, what do they need to do to like, kind of reach out to you and like, kind of quote unquote impress you?
Yeah, follow us on LinkedIn, and then I would say find a way to get a referral to me. And this is the thing I wish I had a better method for this, but if someone emails me directly, it's gonna be challenging because my inbox is crazy.
Yeah.
But if you find someone that I'm connected with and they introduce off a strong recommendation, like that goes a long way. That's the best way to come talk to me, or find me at a networking event. Come on Wednesday.
Yeah, actually, I'm gonna send an email to all the people demoing probably tomorrow, or the day after, and let you know there's probably like 25, 30 people on the list who said they're coming to like look for jobs, right?
Cool.
Yeah.
Cool. Yeah, come talk to me then.
Yeah. So what do you and Dopl want to get out of this tech event I'm doing?
Just exposure. Show people in Seattle what we're working on and connect with folks in the community who want to help us, who are interested. That's the big one.
So I don't know if you looked at any other companies demoing, but if you have any other demos you're excited to check out yourself? If the answer is no, the answer is no.
The answer is no. I haven't had the time.
Okay.
But, I'm looking forward to just seeing what other people are working on.
Yeah. So next question. What do you see the future of? Let me backtrack. So you're talking about your company some, but go in more detail, like how the company got started, what you focus on now, and like your big dream future vision of it.
Yeah. So just basic problem that we're focused on right now is access to specialists. Further you get out from like an urban area, the less likely you are as a patient to have access to a specialist that can treat what you need, whether it's a diagnostic exam or an interventional procedure where they fix whatever's wrong. We're addressing that by enabling specialists to treat patients over distance through telerobotics or remote robotic diagnostic exams and procedures. We're starting with diagnostic ultrasound. It's an incredible tool that is used for the early evaluation of pregnancy, diagnosis of heart disease, cancer. Like ultrasound's the new stethoscope. So that's where we're starting. enabling sonographers, those ultrasound specialists, to perform exams on patients over distance. Our bigger vision is to develop a platform that connects any medical device to a remote specialist, enabling those specialists to treat patients over distance, not just for ultrasound, but for all types of care delivery. And so that's what I'm really excited about, because that's going to lead to lower cost, on-demand access for patients everywhere for whatever they need. And so that's our long-term goal. I'm not sure what your second.
Like what do you focus on right now?
What we're focused on right now is going from our current beta, which we already have, to our MVP, and then taking that MVP through FDA clearance next year, and then taking our product to market shortly after that.
And I guess your big dream is that everyone have equal access to care in the future.
Everyone to have equal access to care, no matter where they are, no matter what they look like. They deserve equal access, and we're creating that.
And so your remote people, where are they going to be located at? Just different places.
Yeah, different places. So one of the beauties of this is we're changing the way we're changing the workforce. And so when you look at sonographers, these are folks who tend to live in big cities like Seattle. They drive into work. When they are treating patients, they'll go into the room. They'll have to get in these really weird angles to like reach over patients and scan them. They get a bunch of gel on their hands. They got to clean up the gel. And when they're doing this remote robotically, they can wake up, have a cup of coffee, work from home, grab a controller, beam into the hospital with the next patient, perform that exam from the comfort of their desk in an ergonomically comfortable configuration, and then drink their next cup of coffee and do the next patient. And so really these folks can live anywhere now and treat patients anywhere, and that's a significant.
And how do you make sure these people keep up to speed on the skills they need?
Yeah, just through exams, exam after exam, and through our platform, we'll be tracking the exams that they perform, and different metrics about the procedures.
And then, how about this scenario? Like, suppose there's a patient, we'll say in Alabama, right? And they're like, hey, can you tell me where the person is located at, right? Yeah, that's something you would tell the patient, or you're like, no, you don't need to know that.
We'll have the ability to tell them, but really, I think that'll come out in preferences and just getting our product out there and seeing how people respond to it.
So, follow-up question.
Yeah.
Let's suppose they say, I want to know where this person at, and you say they're from California. I don't want no motherfucker from California doing my shit.
Yeah.
You know, like what happens then? You know, like you're like, ma'am, I'm sorry, but the guys from California, they like refuse to do it, right? Or you're like, okay, we have someone from, I don't know, Colorado do it, right?
First off, I'd ask them to not curse at me. But no, I mean that's one of the benefits of telerobotic is that we can align with patient preferences, and so whether it's geographic based, state based, or gender based, if you're getting a breast exam, you want a woman to do that.
Yeah.
Because we'll have this large pool of sonographers, this large workforce to choose from, we can better align patient preferences with the workforce in ways that can't be done today.
How specialized is the skill to be a sonographer?
These are brilliant folks.
They have to go to school, certification, stuff like that?
Yeah, they go to school for 2 to 3 years. And
so it's like a medical tech thing?
Yeah, and it's all about, well, not all about, but a big part of it is about how so for example, during a cardiac exam, you've got to take this ultrasound probe and shine it at a very specific angle between the ribs to get to get an image of the heart at a very specific angle, and and then capture that for a remote physician that's going to review that later to then diagnose that patient. And so you've got to know what you're doing, you've got to know what you're looking at, you've got to know how to manipulate that probe, you've got to know how to communicate with the patient to have them hold their breath or at the right times. And there's different anatomy all across the body that looks different, and so it's a very high skill requirement to do that job.
I would think obviously you want 100% success rate, but it was like an acceptable failure rate for this.
Yeah, I mean, on par with sonography today. So not every patient that comes in gets a successful ultrasound exam.
Different body types, different whatever it is.
Different body types, different patient anatomy, different sonographer skill set, and so all of that and more sort of results in the success rate that we have today. And our goal is to at least be on par with that and eventually exceed that.
So I guess it's considered what's called a blue collar skill. Instead of white, this white collar skill, blue collar skills, like these be considered maybe be a plumber or electrician.
Are you saying will they eventually be, or
are they right now? Yeah.
No. I think this is a highly skilled.
Okay.
These are highly skilled technicians that.
And they go to college for this, or like certain trade schools they go to?
Yes, at trade schools.
Okay.
So there are like sonography schools in Bellevue, and Spokane, for example, that specifically focus on training sonographers.
I'm guessing they paid a pretty decent amount of money too.
Yep, pretty decent.
Pretty specialized.
Yep.
Is there a shortage in these skill sets?
So that's actually interesting. A lot of people talk about the shortage. There's not actually, at least in the U.S., there's not a shortage of sonographers. There's a distribution problem.
Big difference.
Yeah, big difference. And so we look at
you said most of them are big cities, right? So
exactly. So there's lots in big cities.
Let's get up just a little bit.
Yeah, my bad. Lots of sonographers in big cities, less sonographers in rural areas. And so what happens is patients in rural areas all drive to the big cities to get care, and that creates these long lines and all this stress on sonographers in big cities, and so everybody loses. But now through telerobotics, when we distribute care, now we can enable every sonographer everywhere to have a level load, and so then we can distribute the patient demand over that whole sonographer workforce.
So Ryan, how does Dopl succeed? How are y'all successful in the future? Or now?
Yeah, we're successful by helping patients access the care that they need, and so we're succeeding right now by hiring sonographers and driving them out to rural hospitals to perform in-person exams. That's the outreach services that we have today. We'll be successful next year when we roll out our telerobotic system in a few hospitals in Washington. We'll be successful after that when we scale up through our first rural hospital network, who we have an LOI from, worth $120 million in annual revenue, and then we'll be successful when we scale across the U.S. and in foreign countries and start to roll out full autonomy. So that's sort of how I look at our go-to-market from a success perspective.
All right, follow-up question. What has to happen for you to say, okay, this isn't working, I need to shut this down?
Yeah, that's a real question. And I think just being real with ourselves, looking at always looking at what we've built and the market dynamics and what our strategy is, and just trying to be as real as we can with ourselves about what's working and what's not working. Everything that we've seen today is pointing towards this massive opportunity. So when we get there, as we make progress, we just have to be real with ourselves and make sure we're still pointing in the right direction.
How you do this, right? Like, suppose someone on your team comes to you with an idea, right? You're like, man, this is kind of not a good idea, right? Like, how do you do that? Like, do you say give them feedback, and give them the reason not a good idea, or you stumble a bone, go try it for a little bit and we come back to it? How do you work with that?
Yeah, situational. I always try to foster ideas. I try to never shut down an idea. I know what that feels like, and I think there are incredible ideas that are born out of ideas that originally were not that great. I'm gonna try to use positive language there. But then like sometimes like we just got to be laser focused. We don't have time to we don't have the time or resources to play around with ideas. We just got to build this one thing to achieve this milestone. There are other times where we've actually got time. We can experiment, and so I think it's really a situational sort of thing.
So I know you said you're gonna announce later on, like a couple months, who you're building, like who you're gonna hire. But can you like give us like the positions, like software developers, marketing person? Like, can you at least put that out?
Yeah, if you've developed medical devices in the past, and you are passionate about improving access, and you have full stack engineering experience, come talk to me.
Okay.
That's one of the roles we're hiring for, and those are some of the key characteristics that we're looking for. That's not the only one, but that's one of them.
Nice. So Ryan, is there anything I should ask you I haven't asked you yet, or anything else you want to talk about?
No, I mean I think that covers it.
All right. So just a couple more questions. Who do you consider as your mentors right now?
Oh, all of our advisors. I'd say I'm gonna give a shout out to David Garner. He's our chief business officer. You know him. He's done a lot, and I've had the opportunity to learn a lot from him, particularly over the last year about building, growing a business and team. And so he's a big one. My family, just always in my ear about just always talking to God and staying prayed up. And it's gonna sound weird, but my daughter, just the way that she, even though she's only 8, the way that she seems to understand and support is pretty incredible. And so those are the people that come to mind.
And then, are you mentoring anyone?
I don't know. I don't know. Not formally.
Okay.
I would say, but I'm always down to chat about my experiences and see if they resonate with people. So if I've done that recently and someone considers me a mentor, then it is what it is.
Yeah. Can you share your social media or just other ways for people to reach out to you?
Yeah, Ryan James Health on LinkedIn. That's my main social outlet. I'm hesitant to share my email on this, but if you can find a way to connect with me, feel free to email or text me. You can get my contact info.
Or come see his demo.
Or come see my demo.
The best way to see him.
Yeah, the Cavness HR event, July 30th from 12 to 4. Come see us. It's going to be a great time. Looking forward to it.
So last thing, can you give us any advice or wisdom or anything you want to talk about?
Yeah, take the first step. I would say if you're a potential entrepreneur thinking about starting your first company, just take the first step. That's the biggest one, and then everything else will come after that.
Dr. Ryan James, thank you for your time today. Really appreciate it.
Thank you.
And to our listeners, thank you for your time as well. Remember to be great every day.